Hello, and welcome back to the Authentic Physician Show, where we have honest conversations about medicine, identity, and health transitions women aren't prepared for. If you're a woman juggling work, caregiving, and a body that no longer responds the way it used to, you're in the right place. Today's conversation is not about perfection, it's about truth. And I'm delighted to have with me as my guest Dr. Christina Campbell. As we go through this conversation, we are going to dig deeper into her story and how she is changing the world by looking at medicine through a different lens. So, Dr. Campbell, welcome. Thank you for coming to the show.
Thank you for having me. I'm excited.
I am excited to hear your story. We met through a virtual colleague, and so this is one of the first times we get to really sit down and chat and
Yeah.
learn more. And I'm so impressed with the little bit I know. But before I go into that, why don't you tell us, tell the listeners, who are you? What's your credentials? What was your training? That type of thing.
Yeah, so I'm an osteopathic trained physician, board certified in emergency medicine, and I'm certified in functional medicine and endocannabinoid medicine. So I have a few things that I practice. I started in emergency medicine with a dual residency in internal medicine and ER. But early on, I dropped that internal medicine piece um, just out of frustration that no one seemed to get better. And I focused most of my attention early in my career on emergency medicine. And then since then have transitioned sort of back into that internal medicine piece that I learned early on in a functional medicine practice, which is very rewarding. So that's
I have so many questions about that. There's just so many different thoughts that are like competing in my brain right now. Before we do that, though, can you just, for the purpose of this conversation, define for our audience a couple things? One, help us understand what an osteopathic physician is. And then number two, just give a very brief overview of how you're using the term functional medicine so that we're all aligned.
yeah, absolutely. So osteopathic medicine is I was actually started by an MD, medical doctor, right? Andrew Chaler Still, who started osteopathic medicine. If you want to categorize it, it is more of a holistic picture, understanding that everything in our lives affects our health and vice versa, and understanding that structure of our bodies as well. So there is a lot of people are familiar with chiropractic, so it's not chiropractics, but we have that a lot of that same similar hands-on training as far as you know making sure that our bones and our tissues are functioning the way that they should, fascia layers and all the different things that connect us as one being, right? So that was my initial training. And
And I can attest that if you go through the traditional way, that's not what we learn. So I can definitely say there's a difference there.
Yeah, there should be more of a difference. And honestly, when I learned how much I didn't know later in my career, I was a little disappointed that there wasn't more of that.
Right.
A lot of my hands-on training once I got into internship and residency was very similar to MD training, although because we had fewer numbers, I got probably a little bit more um, procedural training early on than
Mhm.
most MDs do. But
Yes.
that all evens out over time, I think. Um, but interesting now, of course, the DOs and the MDs they're together now. They've combined
Yes.
forces in
Yes.
residency, which is what it is. So I don't want to
Yeah,
go down that rabbit
there's
hole.
so many layers to what you just said. Okay, conversation for a different day. And actually, one thing it made me think of too when you said holistic, maybe also differentiate to the degree you can between what you're doing and naturopathic physicians.
Yeah, that's a great question. And I don't know all about naturopathic training because I haven't
Hmm.
done that, although I've considered it. Um, my understanding from those naturopaths who I am friends with, it is more of a focus on plant-based medicine, natural medicine using herbs and lifestyle and the biochemistry that we know. That's actually very similar to what I'm doing in functional medicine. I like to call
Yes.
it personalized precision medicine or root cause medicine. Those
Hmm.
are a little bit closer, but most people know the term functional medicine now. So
Yes.
and that is my official certification. But I
Okay.
think there are still issues in functional medicine that need to be fixed. So
Yes.
um, I'm all about personalized precision medicine. It has to be
Hmm.
about you, your body, your chemistry, your
Yes.
history, your physical location, your environment, your lifestyle, your emotional traumas, and those are individual to you, only you. You're the
Right.
only person, right? So you can't use protocols. There's no such thing as recipe medicine when you're dealing with a single human being. And that's the beauty of what I do. And the
Yes.
results come because I'm working with a single person, not throwing out recipes.
So I have so many echoes of different over the years, people telling me in the traditional world will say, so the including the DOs, but the traditional path where you go and you work for an employer now and you see 20, 30 people a day if your primary care specialties, right? The ER is just nuts. I don't even want to guess how many people they see a day, but it's very much within the confines of that bubble, right? And it's very replicatable across every hospital across the country, it seems
Mhm.
like. So some of the echoes that I'm coming up with is our colleagues, right? Like, and I'm not as far down the functional training pathway as you've gone, so I don't know nearly as much. What I do understand is that a lot of our colleagues and how we were trained is to really brush off the idea of functional medicine or plant-based medicine, right? We're
Mhm.
trained to do the prescriptions, not fix the root cause, as you were alluding to, or really step back. What is the most natural way to treat this? And
Mhm.
as I think about all those pushback comments that you've heard, that I've heard, what's fascinating to me is I don't think a single patient is going to come in and say, "Please apply a protocol to me." When
Right,
I'm wearing my patient hat, I
right,
don't really care what worked for 2 million people. I care what's going to work for me, right?
right.
And this seems almost blasphemous to the medical community training we've received, right? And so when I put my physician back on, I'm looking at the studies and all the research, it's all maybe not all, but a lot of it is population health.
Mhm.
And so maybe walk us through. Actually, before we jump in there, I want to throw a question here for fun too.
Mhm.
You just went over all your credentials, and we could spend a long time going through those, right?
Mhm.
But who is Dr. Campbell when she's not wearing her physician hat?
Oh, that's a great question. Um, I am very independent thinking. I live my life through my heart, or at least I try to, and to some degree, probably that's a detriment, because it hurts sometimes,
Yeah,
right? But
it does.
I am heart led for sure. I like to be active. I like to be changing the world for the better. Like if
Mhm.
I feel like I'm here, there must be a reason why I'm here. So
Yes.
if I can figure out where my purpose lies or where I find joy in helping,
Mhm.
and where I can see real results from doing that time, spending that time, then that empowers me or that makes me feel wonderful and makes me want to get out of bed to do something, right? To accomplish my day. I'm a family person. I love my family. And it was one of those amazing, you know, God led things that I was able to have, that I was told many years. And I don't know how much you know about my story or what you've read, but I was
Tell us
actually
all.
told I would never have children. So
Yeah.
to have two of my own was a real blessing. And it was a struggle. And I went through a lot to get there.
Mhm.
Um, but I just cherish that. That's probably the best thing I've done in my entire life is these beautiful kids.
Oh, I love it. Thank you for sharing that because I think it's important that we see the humanness, right, of each other and not just the accolades and credits because
Mhm.
everyone who's listening to this has something they've done that we can brag on. But
Yes.
everyone also needs to be seen as the person they are, who they're created to be and called to be, and the impact they're made. And so, for our listeners, if you're feeling like, how does this conversation apply? Stay tuned because you're about to hear a lot of cool stuff. But I think it's important that you hear what Dr. Campbell said, which is you are worthy, you are valuable, and it's not because of what you've done. It's not your identity being your job. You are a whole person without the job. And I love that you were able to articulate that. So, jumping back into where we were going now, and I really have this awesome, sexy frog voice going on. So, apologies, but I'm coming
It's
off
very
of a
Phoebe.
cold. It is. It's like, can I stop doing this? But I'd love to explore a couple of ideas, and you can pick where we go with this. One is the idea that there are a lot of high achieving, ambitious women who love their families, who want children, who may have had the same story that you shared, some parallels anyway, not the same, but really feeling discouraged.
Mm,
in a place where they are hearing, "You can't do this. Time's up. You should have had kids earlier. Should have," right?
Mhm.
That's one pathway we can go down. The other pathway that I think would be super interesting is how much do you want to go into the functional medicine? Because in our community in St. Louis, we are seeing an explosion of people looking for functional medicine because they're hearing so much about big pharma and manipulation of big medical organizations. Rightly so. We need to call these
Mhm.
things out and be transparent, right? So I have a lot of patients who come to me and want to know more about, why aren't all doctors doing this? Why are my doctors not thinking about the underlying cause? Why am I just getting a prescription? Why are they not looking at these tests, right?
Mhm.
Chat GPT is telling me more about this than my doctor is. So, where would you like to go? Because I think both are equally important aspects of your story that you can share.
I can do either. Whatever you guys wanna talk about, I'm good.
Well,
Yeah.
then let's go a little bit toward the first pathway first,
Mhm.
because I think that that is more silent of the two. I think a lot of women
Mhm.
suffer
Mhm.
um, for years, many times, before they feel that they are able to live with the experience that they've been through. So, wherever you want to go with that and speak to that.
Can you I'm not sure where to start there.
No, you're good. It was a very vague question because I don't think that probably every woman's story is the same. For example, we have 5 kids. Our first 2 were very easy. The next 2
Mhm.
were extraordinarily difficult.
Mhm.
And so what is when you've got a hardworking, ambitious woman who's trying to climb the career ladder, she's amazing at work, and she's coming home, and she really wants her heart just is aching for that child, and the child
Mhm.
isn't coming.
Yeah, I can completely feel that.
Mhm,
I remember how that felt, and it was
mhm,
awful. I at the time so my husband and I didn't find each other until I was 31. We got married at 31. So we had been dating for a year, engaged for a year, married, and we were just coming out of our residency. So starting our careers, finally trying to pay off $1 million in debt between the two of us or more.
yeah,
And so it's very stressful. And we were also very established in our routines. So we're
yeah,
right. So there's a certain amount of that first 5 years is really
mhm,
learning how to live together despite loving each other. Right.
right,
And then we started trying. So we called it pulling the goalie.
mhm,
And yes, I was on birth control because I was afraid that I wouldn't be able to get to my goals. If I had it
yeah,
to do over, I probably wouldn't have taken that
yeah,
now that I know what I know. But
mhm,
that's a whole nother pathway of talking.
yes,
Um, but I was working in the emergency department and I was doing shift work. And most ER doctors, when they sign a full time contract, are required to work days, mids, and nights and shifting that all the time. So you're working 7 to 3, 3 to 11, and then 7 to morning or whatever. And so you really never get a good sleep. You don't get good hormone cycles. We know this
mhm,
now, right? Like I
mhm,
didn't know that back then.
yeah,
Um, but having that constant rotating schedule and no circadian rhythm whatsoever really
mhm,
impacted me more than I knew. And when we began trying, I had multiple miscarriages. I had 3 miscarriages. Started diving into, well, what could be wrong? We did all the things. We mapped out all
yeah,
mapped out our monthly, right? The monthly things. Okay, now's the time, and
mhm,
that kind of takes away the romance part
mhm,
of being intimate with your partner, which is not awesome. So we quit doing that because we are like, yeah, that's not working for us.
right,
There's no
right.
fun in that, right? And it's so
It's a lot of
inconvenient.
pressure.
And a lot of pressure, exactly, and the more I felt like the more pressure we put on it,
Mhm.
the harder it was to be relating to each other, and it took away
Yeah.
the intimacy between us, which wasn't awesome. Um, I have a long history of where these issues for me began.
Mhm.
I was diagnosed with an autoimmune disease when I was very young, and I was actually told when I was 14 I would never have kids, so,
Mm.
um I'd been praying for my family and what it would look like for many, many years growing up Catholic, and I think there was a lot to that, and my belief that God really didn't believe what this stupid doctor said to me. And I mean that
Mm.
in the most respectful
Yeah.
way. That was just a
Yeah.
dumb thing to say to a 14-year-old. How could they possibly know, right? Um, but just based on the illness I had been diagnosed with, that was their opinion. And I refused to accept that, which was a huge part of my success, I think. Just that refusing to accept what just didn't seem right. Having your own viewpoint of what is told to you. And it's so hard to do because you go in and you're trusting this doctor to tell you all of their expertise and all these things. And you want to believe everything they say, right? But then
Mhm.
sometimes they say things that you're just like, what?
Yeah. And
How
maybe
can
they've
that
only
be?
met you 15 minutes. Like, they don't know you.
If even, right? If
Right.
even
Right.
sometimes. And so at that time, I was in my late 30s, 36, 37 ish, and 36, must have been 36. And I went into my job and I said, we were shorthanded. We didn't have enough doctors. So I was doing full time shifts and then some and rotating. So I was doing way over what was considered full time, even though contractually I was only, needed to do a certain number of shifts a month. And so I went in and I told him, I'm not going to do nights anymore, no nights and no weekends.
Mhm.
Um, I am, I'm working in this inner city hospital. I'm miscarrying while I'm working with people, right? And
Jeez.
it was awful. It was very difficult. And I said, look, I will still work the full time number of shifts. I need a part time contract so that I
Yeah.
can physically be around my husband. Like the
Mhm.
basic birds and the bees. How can I get pregnant
Mhm.
again if I'm never home? Right.
Right.
Number one. And number two, I need sleep. Like
Mhm.
and I didn't realize how powerful fixing my circadian rhythm would be. This was actually the first, real N=1 experiment that I did on myself, not realizing it was an experiment. But
Mhm.
fixing my circadian rhythm where I was up in the morning and sleeping at night every single day. And I was always a person to be outside. So once I had a normal schedule, I would be outside during the day in the sunlight.
Mhm.
And I fixed my circadian rhythm. And that was a huge piece of me getting pregnant because now my hormones are cycling the way they're supposed to,
Just
right?
the basics. Get the basics right.
Basics. And then the other thing that I stumbled into, and this is really all God wink, because I didn't know functional medicine. I didn't know any of these things that I know now.
Right.
Now, looking back, I'm like, thank God I was
Yeah.
led to where I needed to be, that I've been
Mhm.
praying to be led for so many years. I couldn't, I have a lot of, in my history, I was diagnosed with Crohn's. So I had a lot of gastrointestinal issues all the time. And I could not take the prenatal vitamin that they all wanted me to take, that big horse pill. I couldn't
Yes.
do it.
It's
And if
yes.
I could get it down, then it would upset my stomach for all day. And so I went looking for a natural version. So I talked to my OB. I'm like, I can't take this. Like, I
Yeah.
understand I need vitamins, but I can't take this pill.
Right.
It's making me miserable. So I went to a natural health store somewhere near me, and I
Mhm.
stumbled into methylated B vitamin. Of
Okay.
course, this is before all of our genetics
Mhm.
were mapped out, and that we
Right.
understood MTHFR and methylation
Yes.
deficiencies. But as it turns out, I have
Mhm.
huge methylation issues and accidentally fixed it with this methylated B vitamin from this natural company that, for whatever reason, it's whole food based, which is
Mhm.
why I chose it because I figured my gut would do better with it. And it did. And then I got pregnant and carried,
That's
right?
amazing.
And so it was kind of like magic. And then, of course, I had more miscarriages in between, and
Yeah.
we had two. Ultimately, I'm gravida eight, para two. So,
Which means what for our listeners?
gravida eight, so 8 pregnancies,
Yeah.
and 2 lovely children that came full term. And the rest is just painful to talk about.
Yeah. Absolutely.
Mhm. But I remember Mother's Days. Mother's
Mhm.
Days would come and I would be happy to celebrate my mother, but
Right.
so deeply grieving, right?
Yes.
The losses that I'd had,
Yes.
the struggle that I was under. And it was really hard, you know?
It is really hard. And even just take away all professional titles, just wearing our humanness, right? It is a deep loss when you desperately want that child and
Yeah.
you cannot hold it in your arms. I have lost children that way too. And our society doesn't set up a grief for that. You're expected to put a mask on and move on.
Right.
Show up to work the next day, even if you're still hemorrhaging. And
Right.
that is not a health focused experience for anyone. So,
Mhm.
thank you for being vulnerable and sharing that. I know at a visceral level that still hurts.
Yeah. I'm trying not to cry on camera.
Fair enough, fair enough. Cry if you need to, no judgment. There have definitely been a lot of people I have seen over the last 15 years who have had similar losses and feel like they can't acknowledge that loss. And there's a little bit of a flippancy many times from the medical community. Well, you got pregnant, you'll get pregnant again. It was just a genetic problem. Don't worry about it. Well,
Mm,
how can you say that to someone who's losing a
right.
piece of themselves, right? And something that's so dearly loved. So, for
Mhm,
those listening, if you're in that, both of us can tell you that we hear you, we see you, we feel you. You're not alone. And certainly we want to validate to you that what you feel is real because it does hurt and
mhm,
it does ache. In terms of, it's interesting that you brought up the methylation because I think that does flow somewhat toward that functional medicine piece.
mhm,
I guess I'm trying to remember, but I don't think I really understood that even the concept of functional medicine until I was out of residency. Because in our medical training, we're a bit of a silo and you don't necessarily see everything else. And if a patient's cared for outside of that academic system, we call, the internal slang is it's an outside doctor, right? Which
right.
almost feels like we're saying it's a quacky doctor, right? They're not a
Well,
real good person like us at this elite institution type of mentality. And no one ever said that. But I think that was kind of the gist is it's the outside
mhm.
doctor. And of course, some of us become the outside doctor and then you're like, "Oh, well, they weren't quacks." But
Right.
right? But I don't think I really ever understood functional medicine. And I remember rounding in the hospital with our teams and somebody saying, "Oh, that's my functional medicine doctor." And us kind of all looking at each other like, "What the heck is a functional medicine doctor?" Right?
Oh.
So, how did you discover it? Did you hear about it in medical school or was it just because of your health story like you were sharing that you fell into it?
Yeah, it's a good question. So I fell backwards into it. I actually had someone accuse me of being a functional medicine doctor, and I had no idea what it was.
That's
So,
even better.
um,
Yes,
yeah,
I'm denying what I don't know.
yeah, yeah. So I began looking for myself. And actually it started after my second pregnancy. So it's actually a good place to begin.
Cool.
After my second pregnancy, so diabetes, cardiovascular disease, these all run in my family. This is the major reason why people pass in my family. And so I had diabetes during pregnancy and metabolic syndrome coming out of it, and I had gained so much weight and I could not get it off no matter. I was running 7 miles a day. I mean, I was eating what I thought was healthy. Again, what I thought was healthy,
Right.
um, which was a big piece of the puzzle. And I was complaining to a high school friend who said, "You're not working out the right way. I'm gonna sign you up for a CrossFit." And I'm always gung ho to try something new. And I've always been someone who lifts weights and is active. So I was like, fine, whatever. I don't care. Just whatever you think will actually work because I can't be 200 pounds forever. I'm 5'3". That's just not okay. Right. And I would think I was at my most, I think I was 250, which was really uncomfortable. It was awful. And um, anyway, so I went to CrossFit. And I met this 6'3" Adonis type with 11 kids, I think, and nicest family. And and I won't lie, he was beautiful to look at. So it was very encouraging to go to the gym. And
Some
I'm a happily
motivation.
married woman, but I'm not dead, And so, and he had juvenile onset rheumatoid arthritis.
Hmm,
And so one night when I went in for an evening class after my ER shift and no one else was there, it was just the two of us. So I had one on one training. And we were talking and he was telling me about rheumatoid. And I said, "Oh, I have, Crohn's." And so that's interesting. Well, what are you? And I'm like, "How are you doing what you're doing with your body if you have this?
right.
Right? Like, how
Right.
is that?" And he goes, "Oh, I control it with my diet mostly. Every once in a while, I have to have medicine, but I mostly control it with my diet." And I was like, "Okay, tell me about that diet. What is that?"
Yeah. Right.
So he said, "It'll help you a lot with weight loss and you should try
Mhm.
it." And so he
Mhm.
taught me all about the paleo diet.
Okay.
So I came home and I said, "Fine, I'm going paleo." I threw out all the bread. My husband got mad and brought bread back.
Yes.
I said, "Fine, but I'm not eating it." So I started eating paleo to the dismay of my entire family, trying to figure out how could I cook for myself and them and all the things. So I went through that. Um, and my family dragged along with me and they came along kicking and screaming, but they did come along with me, which I'm pleased with. And I had been from the time that I was diagnosed with Crohn's, I was diagnosed when I was 12. When I was 14, I had a near-death experience, which is also an interesting story, which we can come back to if you'd like. But um, I was always told it doesn't really matter what you eat, you just need to get enough nutrition in to maintain your weight, because back then I couldn't maintain weight. Then I got metabolic syndrome and I couldn't get rid of the weight. So yeah, anyway, um, where was I going with this? So I started learning about this diet, and I had been in pain really since I was 12. I was always in
Abdominal
pain.
pain.
Abdominal pain, joint pain. Um, if my if the autoimmunity was acting up, my eyesight would be worse, because I had effect there. I would have back pains. I would have joint pains, and my hands especially would swell.
Okay.
Um, sometimes my knees. So I
Yeah.
had pain everywhere, but always in my stomach every time I ate. There wasn't a
Mm,
time that I wouldn't have pain afterwards. And it was just, I had been taught or learned or thought that was just the way it would have to be. And I could
mhm,
either choose to lay in bed in pain or choose to get up and do things in my life, whether I was in pain or not. And that was kind of the choice I made. But I was in pain my whole life,
mhm,
every day at work, every day at home, every day, all the time. And um, after 6 months on eating this diet, I
mhm,
woke up one morning and my hands weren't swollen and my stomach didn't hurt. And I tapped
mhm,
my husband and I said, I don't hurt. Like, that's crazy. And he goes, really? And
mhm.
I go, yeah, nothing hurts. I mean, it was to the point where like I couldn't drive down the road and go over a speed bump without excruciating pain, right? Like, say,
Wow.
I had to change how I drove. I had to change how I walked. I had to, right? And then all of a sudden that pain was gone. And I thought, wow, what could that have been from? Well, now I know it's gluten sensitivity,
Mhm.
but I didn't know that before.
Right.
And so I started to realize how much I didn't know. I went through an anger period and a grieving period over my
Mhm.
training. And then I
Yes.
thought, you know what? But a lot of this is new information. So maybe I just forgive and learn. So I dove deep into, and my husband will tell you, I would bring research articles to the table. I'd be highlighting them at the dinner table. I couldn't
Mhm.
get out of the literature. I was just reading research paper after research paper after research paper, and then applying things to my life. So the next step that I did was detoxing my home from chemicals, because I learned how many, and I'm
Yeah.
still working on that. The clothing part is the last piece, I think. And
Mhm.
then my hair dye, which
Mhm.
I'm not giving up easily. So it'll
Not
be
yet.
clothing next.
Fair enough.
but but all of a sudden now I was off allergy medicines. I didn't have to use my
Mhm.
inhaler anymore. I didn't have to be on steroids. I didn't have to take antibiotics 3 times a year or 4 times a year, because I wasn't getting sick to that place. I
Mhm.
didn't have to be on Allegra for,
Yeah.
right? So all of a sudden, everything I was doing was changing my health, and my husband's seeing it, my kids are seeing it. So they start changing.
Mm.
And now my husband's issues are going away. And so then I'm like, okay, well, what else don't I know?
Right.
So I'm learning more and more and more. And then at some point, I started doing consults on the down low outside of, because people just started asking me questions. And I was
Mhm.
basically, my husband will tell you, I was basically giving it all away for free, if you will, because I was just like so
Mhm.
excited about all the stuff I knew.
Right.
And so everyone's texting me and I'm telling them all what to do.
Mhm.
And he said, that's a business. Why don't you just open a practice? Why don't you just do that?
Nice.
And I was like, you
Nice.
know what? That's really smart. I should do that. And he
Yes.
goes, and then maybe you could put your phone away at the table and the family time
Right.
and I'm like,
Yeah.
yeah, you're right there
Be
too.
more
Right. Like
connected.
okay,
Yeah.
call me out. You're right. So I did that. So I started doing that on the down low, cash based, like just helping guide some
Mhm.
people. And one of the one, one of the people who I was friends with, who worked in emergency medicine in an administrative role,
Mhm.
said to me, I really think you're a functional medicine doctor. And that's
Interesting.
what you are. And I was like, what? What the hell is that? Use
Yes.
my language, but I've never heard of that. I don't know what you're talking about. And he goes, like Dr. Mark Hyman, like, those guys that,
Mhm.
you should just go look it up and get certified. That's what she said to me. And I was like, okay. So I didn't go look it up. And I thought, okay, that's interesting, because at that time I was really hiding from most of my profession what I was doing on the
Mhm.
side. I didn't
Right.
tell a lot of people because
Yeah.
I was nervous. I didn't know, right?
Well, and it's a
I didn't
taboo topic still, right? Like, people still think functional medicine, people being the allopathic and osteopathic traditionally trained, physicians still think
right,
it's
right,
goofy.
right. Um, And even though we do learn what vitamins do, right? We can't
Mhm.
fathom that a vitamin could fix a problem, right?
Right.
Or a
But
mineral or a
you can't know what you don't know until you've learned it, right?
exactly right. Exactly
And
right.
that is just not something we're trained on. So interesting. So a colleague tells you about it, you're like, "I don't know what you're talking about, but I'll check it out."
Yeah.
Eventually you get there and you do that, and I have to ask, like, do you feel like a rebel?
You know what? I did.
Yes.
What I felt like was like I had finally come home. Like I finally
Mm,
found my people
yes.
who understood what I was experiencing in my own health at that time, who understood that there was a problem in our education as physicians and that we
Yes.
needed to go back.
Right.
And actually, physicians used to learn this stuff, by the way.
Mhm.
It was
Right.
systematically removed from our training on purpose
Yes.
and from the books and from the pharmacopoeia. I mean, if you
Yes.
go
On
back,
purpose.
yeah,
Yes. That's
it
the
was
key.
systematically removed. So this is not really new. It's old stuff brought back, and then there is, of course, new things that we know, genetics and
Yeah.
microbiome, and things that are new research that we didn't know before. But I mean,
And it's science-based. Like, that's the thing that kills me about it. Like, there are actual papers on this, right?
oh,
Um,
100%.
so it's not like you're pulling
Mhm.
something out of thin air, hocus pocus. And that's almost the sense that many physicians feel of this is that
Yes.
this is the snake oil salesman going around doing it. And I'm not going to say there aren't those people, actually. I will give that possibility
Yeah.
credence, but
Mhm.
that's not your story. Your story is I'm
Mhm.
following the science, I'm following my body, I'm listening to my own body, what it's telling me, and I'm realizing there's a disconnect between what I've been trained in my traditional schooling
Yeah.
and what my body needs.
Yes.
And you were meeting these other people. So I'm curious, it seems like in my world that I see a lot more women than men who fall into the functional medicine path.
Mm.
And I don't totally know why that is. Maybe it's just I have more women. But in your experience, do you feel like there is advice about functional medicine that women are getting, that they're being told every day and is being reinforced by the medical community, and yet it's actually harmful to them?
Oh, so many things.
I thought you might have an opinion on that.
I'm like, I don't know
I
where
know, I
to
just had like
start.
4 tabs open in your brain, right?
Wow. I mean, the first thing that came to me was putting on sunscreen.
Mm,
So,
say more about that.
okay, so we need first of all we need sunlight. That's how we get our vitamin D. We need sunlight also for nitric oxide, which is what manages our blood pressure in our
Mhm.
vessels. We
Yeah.
get that from UVA and UVB rays.
Mhm.
So the UV rays that they're trying to tell you are killing you, not so much.
Are they killing you only at high volumes, or is there nothing there? What do you think?
So it's never good to damage your skin by burning it, of course. But what's
Agree.
really interesting is that when you have higher vitamin D levels, you don't burn as much.
Okay.
So the sun actually helps you protect you. The body has all of these mechanisms in place on purpose, right? So um, the bigger issue is what's in the sunscreen. If you look at what's in the sunscreen, there are cancer causing chemicals in the sunscreen that they're telling you to put on so you don't get skin cancer, which is just, I mean, I don't even know what to do with that, right? So I quit wearing
A
sunscreen a long time ago.
and they're cancer causing that come through the skin layer, but don't
Mhm.
necessarily cause skin cancer. It's other cancers, right, that
Correct.
there's concerned about?
Correct.
So, interesting. I don't think a lot of people know about this even possibility right now. So, assume all of us are novice beginners, right? You're in your office and it's summertime, and I'm telling you, "Look at this sunscreen. Is it clean enough?" And your answer is, "Why are you even wearing sunscreen?" Is that what I'm hearing?
Not necessarily.
Okay, tell me more.
Okay, because look, so for me, if I'm out in the sun every day for 2 hours and that's my typical, and I'm tan enough to handle that, my melanin is handling it, right?
Yes.
But if I now decide after 2 hours in the sun every day, now I'm going to go on a boat for the entire day. Now out on the ocean. And so this is a totally different sunscreen. This is a different issue. So now you have to start thinking about what can I do to protect my skin because it's not going to be used to that much sun and you don't want to
Mhm.
burn.
Yes.
But there are other things you can do, like a hat,
Mhm.
shade, clothing, right? Or there are
Absolutely.
some lesser potent or lesser issue sunscreens. And I always recommend my patients go to EWG. I love them. I don't know if you're familiar, but the
Tell us
Environmental
more.
Working Group has a
Yes.
beautiful website that will tell you what is in your stuff. It will help you to read your labels, read your labels, read every ingredient. It's really a lot of work in the beginning, but once
Hmm.
you start recognizing, you'll recognize things after a
Yeah.
while. Oh, this
Yeah.
is the one that is okay. This is the one that causes this.
Yes.
Um, but read your labels. But anything that's EWG certified, so they have a quantitative method
Hmm.
of telling you how many chemicals are in your product when you look
Yes.
it up. If it's
Yes.
certified, it's none. If it's a 1, there's very little. If it's a 2, it's a little bit more. If it's a 3, 4, 5, I don't use them.
Okay.
That's my if it's 2 and less, I'm like, "Okay." Except for my
So
hair dye. I'm sure my hair dye is higher than that. As I said, it's gonna be the last one I get rid of.
progress, progress. So
I'm
you're
human.
basically yeah, that's what and I wanted you to clarify all this because I don't want someone to hear you saying never wear sunscreen.
Well, no.
And
Right.
right, because the sun can cause skin cancer. We're not denying that.
Mhm.
But you're saying do it in the cleanest way possible for the least amount of time possible to the point that there's not harm in the strategy you're using. Is that
Correct.
fair?
Yes. So our
Okay.
skin is the largest absorptive organ that we have. It
And
is
when
an
we cover it in
excretory organ,
chemicals.
meaning we excrete toxins in our sweat across it, but we also absorb what we put on it. So we
Yes.
absorb plastic out of our polyester shirts. We absorb chemicals out of our sunscreens into our bodies.
Mhm.
We absorb aluminum out of our deodorant in our lymphatic system under the breast. There's a reason why, right? There's a reason why these things happen. So
Yes.
it's important to understand that what we put on our skin needs to be healthy,
Yes.
nutritive, and not harming us.
And at a fundamental level, I think all physicians would agree on the fact that we don't want to be using something that's harmful, right? So this is a place that we can connect with our colleagues. And what I like about functional medicine and the science that is there, there's more to come, but it's not a catch-all bucket
Mhm.
of trickery and potions and hopefulness. And there may be things that we don't know yet that we learn later that we can then understand better about why something does or does not work.
Mhm.
There's a lot of women, you talked about a little bit. I'm going to jump back to where you were talking about the food. You were told just to eat anything in order to put on weight and grow and whatnot, and how that backfired on you. A lot of my patients who are mostly 30s, 40s, 50s, these women find that what they've been told about nutrition specifically throughout their entire life is different than perhaps what we now know to be true.
Mhm.
And I'm not getting into how the whole food pyramid slash my plate all just changed, but I'm acknowledging that within the medical realm and silos, there have been mistakes made. And there has
100%.
been incorrect information applied to massive populations.
Uh-huh.
And I don't hear a lot of admittance toward that or how do we fix this? And
Mhm.
so many women in this age range, they are either caring for parents or young children. They're trying to climb the ladder or they're the CEO of their house, right? They're
Mhm.
not sitting around twiddling their thumbs. They are busy doing a lot of different things.
Mhm.
And their body is carrying the burden of all that. And
Mhm.
we give them bad nutrition. It's like putting diesel in the gasoline burning car, right? That's the easy analogy. We
Mhm.
wonder why their bodies break. And you're explaining right now it's because of all the factors that are ingested, inhaled, applied,
Mhm.
and there's not enough nutrition specifically advice, but toxins in general. And so, question for you kind of, I guess this is more of an analytical thinking type of question. What do you think women in this season fundamentally misunderstand about their bodies?
That's a really good question. Um, and there's so many places I can go with it. I think one of the things that has been and recently corrected has been, the use of after menopause or through perimenopause, the use of hormone therapies and to try and balance out what's changing in our bodies.
Mhm.
My belief is that fundamentally we are not meant to lose our hormones, right? As we age, we're meant to keep them. And if our inflammation in our bodies are working well, if our inflammation is low enough and if our bodies are working well enough, we actually can maintain our cycling much older
Mhm.
before we lose that cycling of normal hormones. And I would argue that we should be able to carry that all the way to the end if we're healthy enough.
Interesting.
Hard to see that in
Mhm.
action in this
Right.
world that we're living in. Um, but very interesting though, and I alluded to birth control. So birth control
Mhm.
being a synthetic hormone that I did take and would have, now knowing what I know, chosen not to,
Mhm.
because independently the synthetics can cause increasing cancer risk, and also can um, cause a dysbiosis. And the gut is really the center of health for a lot of areas of our systems,
Mm.
right? So our immune system is seated in the gut, our microbiome, which feeds the brain. So that gut brain axis, the gut lung axis, all there's an axis with the gut and
Mhm.
everything,
Yeah.
right? And the highway is the vagus nerve, which is a major nerve that runs through the entire body and connects it all, and which is where emotions come into it. So I may be going down sort of I don't know.
I think it's a part 2. I mean, it sounds like there's a lot
I
there.
feel like I'm going down a tangent, but in
Oh, I'm
regards
still
to the
trying to get
hormone,
over the fact that you said you can cycle to, like, the end. Like, my brain is still trying to catch up with that, that you don't think menopause should be in the early 50s like it is now. You think it should be much later or not happening. Is that what I understood?
yeah, I do.
Okay,
I think if our
interesting.
bodies, I do. I think if we can keep our bodies healthy enough, truly healthy enough,
Mhm.
and there are all the mechanisms are present in our bodies to do so, but it's that bombardment of toxins and inflammation and stressors and
Yeah,
that keep us unhealthy. Um, It's just a gut feeling, like, I have no proof, right?
yeah.
I just feel that,
Well,
and
yeah, we don't
partly
have that.
because I have older women that come to me that are trying to get pregnant, and they haven't been cycling, or they have right, their hormones are already changing, but they're hoping, and and maybe that happens, maybe it doesn't, and it's all individual case, right? But I've seen women who were already fully in menopause, who were on hormone therapy replacement, get off their hormone replacement and have their cycles start again.
Okay.
So I know a handful of people who've had that happen in their mid 50s. So
And playing
that
devil's
to me
advocate,
was like, really prove it to me. And then
yeah,
that was a very detailed physician to physician, friend to friend
yeah,
conversation. How do you want me
yeah,
to prove it to you? But
right.
I was hard pressed to accept that. I didn't
Mhm.
believe that my friend was right. How is that
Yeah,
even possible? Because she'd healed her body enough and reduced her inflammation enough that now her HPA access to the all the little guys in the brain and the body that produce our hormones ultimately, or that create our hormone pathways,
yeah.
we're now working again. So theoretically, I think this could be a thing. In practice, the way our world is, not we don't see it,
No, we
right?
don't. And I mean, the obvious pushback to this woman's story, which I'm not discrediting her at all. I haven't heard her, I haven't met her, but I think the natural thing everyone's going to say who deals with hormones is, well, she wasn't cycling and she was in menopause because you had her on constant hormones that whole time. You take the hormones away and her body was still doing what it always would have done. She wasn't ever actually in menopause. Like, I think that's probably the counter argument that people push back with.
Well, except she started the hormones because she was in menopause.
And so that's, helpful to clarify. And this is where we get in trouble because there's one-off situations for everything. But
Right.
I'm just like, my mind is wrapped around what you said. I'm stuck on that point that maybe menopause, because that's who I treat as women in midlife, right? And
Mhm.
this idea that maybe menopause isn't really the average age 52. And to your point, like, we don't know because
Mhm.
historically people died before they got there
Right.
and life
Exactly.
expectancy didn't make it this far.
Mhm.
So it's a very interesting thought. um, I have a feeling that's a part 2, though. We're gonna have to go down that pathway. Like, I gotta get my brain disconnected there for a second, because we do need to wrap up. And one question I have that I think I'd just like to hear your thoughts before we let you escape is, you are passionate about helping and healing women, and you are brave enough to challenge the status quo and everything we've been taught and to be a thought leader in thinking differently, right?
Mhm.
Following the science, what does the researching show? And so Is there just maybe one belief about women's health that you refuse to compromise on? And maybe it's what we've already talked about, but is there one thing that just, no, this is your North Star on women's health that is not negotiable?
Yes, it's your health, right? We are responsible for our health, and we have to do the work to get there. And I'm not blaming the victim here
Mhm,
because it kind of sounds like that, but more what I would like to do with that statement is empower you. If there's anything I wish, is that I wish I'd have come across someone like me when I was younger so
mhm.
that I could have realized earlier what I was missing.
Yeah.
Because the pain and suffering for the 30, 40 years that I was in pain and suffering all the time
Mhm.
didn't have to be, as it turns
Right.
out. Um, and 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 it's okay to question your doctor.
Mhm.
Do you know? I mean, so eh, I'll just bring my point home really dramatically. So, because if there's anyone who questions their doctors or everything, that's me.
Mhm.
I
Mhm.
question everything, I think through everything, and I choose my own answers.
Mhm.
Um, to the dismay of many people who love me. It's not easy, right? It's not easy. But when I was diagnosed, I think I told you I was diagnosed with Crohn's when I was 12, and at 14 had a near death experience. Well,
Yeah.
legitimately near death experience, which could be a whole nother conversation too. But I was in what they called a coma. I was completely unresponsive for 3 days. When
Mm.
I woke up, there was a surgeon who, and I had mouth to anus. The
Mm.
whole GI tract was covered in lesions
Mm.
from Crohn's at that time. I had an upper scope and a lower scope and a barium swallow and all the things, and it was everywhere,
Mhm.
right? So the surgeon stood at my door. He didn't even bother walking in the room, which was completely offensive. Please, if you're a physician, walk in
Wow.
the room and sit down with your patient before you start speaking. Not okay. Right. So he stood at this and he stood in the doorway, like in the door jamb of my room. And he told me that I had to have a complete colostomy, a complete colectomy. They wanted to remove my entire large intestine. Um, and then I would have a little bag that would collect my poop outside of my, right,
For the rest of your
for
life.
the rest of my life. And I was 14.
Mm.
Um, and he said I wouldn't make it to my 15th birthday if he didn't do that. Well, my 15th birthday was 2 weeks away, and I felt very threatened and I was very angry
Mhm.
about it. It didn't respond well to that. And in my mind, it didn't make sense. Now, my dad was in the dental school. My stepdad was in the dental school at the University of Florida, Shands Hospital, which is where I was hospitalized at the time. So I had him pulling articles for me because he had access to the medical library. So I was in my bed reading articles on Crohn's
At 14.
at 14 because I didn't want the surgery. I was looking for a reason. I was looking for an answer.
Mhm.
So I refused the surgery, told my doctor I wasn't going to do it, signed all the waivers, begged him to come up with something else. And I
And
told
had
him,
to convince your parents, right? Because as a minor, they had to be on board with that too.
I was very lucky that my parents did not force me because, yes, they could have signed a paper and it would have been done and my
Yeah.
whole life would have been completely different. And I
Yes.
genuinely believe that this didn't make sense because it wasn't curative for Crohn's at the
Mhm.
time in the literature. So then what was going to happen? And that's what I asked my doctor. Okay, fine. So you take it out. And I've got this little bag, and that's awesome, right? And then I get sick again. So now what are you going to
Mhm.
remove? Part of my
'Cause you
small
still have it. Yeah, you still have it from mouth down. It's not like he's fixing the problem.
according to the conventional medicine literature in the 1980s, yes,
Mhm.
right? I
Wow.
would argue against that now.
Yeah.
And that's again, but at that time, yes. So I refused the surgery. My parents backed me. My
Mhm.
doctor was mortified and didn't know what to do.
Mm.
But luckily, he was the kind of guy who would think outside the box. He had daughters at home that were around my age. He took some of my concerns, which were very teenage
Mhm.
verbiage,
Yes.
um, about all the things and the reasons why I didn't want to do this course. But the biggest one being I really felt it was setting me up to be on disability. I don't want to
Mm.
start my life on disability. That didn't make
Right.
any sense to me. And so he came up with a plan. He came back to me. He's had me sign all the things saying he wasn't liable if it all went wrong. Um, and he did what was called complete bowel rest and hyperalimentation. I think he just made the words up, but he basically we put in a catheter into the subclavian and I went home on it and I homeschooled that year of high school. and fed me through the catheter and nothing to eat by mouth for a year.
Wow.
Eat or drink, nothing.
Wow.
Um, and at the time, I was also completely allergic to the only medicine on the market, which was a sulfa based medicine. So we did high dose prednisone, high dose steroids,
Mhm.
and he desensitized me to that medication until I could get back onto it. He
Okay.
saved my life. I still have every inch of my intestine,
It's amazing.
except for my gallbladder, which I willingly gave up and wish I hadn't done that either, but I didn't know.
Right.
So, my point being, make your own choices and it's okay to buck the system and you will get
Mhm.
pushback, but
Yes.
it's okay.
Right.
Go and find a physician who doesn't give you pushback, who's willing to think outside the box. There are some of us out here.
Right.
There's some of us who've seen the tragedies and the things that happen,
Mhm.
um, when we force people
Yeah.
into their little hole that we carve out for them.
Right. Right.
Does that make
And
sense?
so it makes a lot of sense. And I think many people are probably going to want to learn more about your work and what you're doing, maybe learn how to connect with someone similar to you in their communities. And so if they do want to get in touch with you, what's the best way to do that?
Yeah, so you can go to my website, naturallyfree.life, or not naturally free, yes, naturallyfree.life. And then you can set up a call with me through that website and we can have a conversation about what's happening with you and what your thoughts are. And I can let you know if there's something I can do to help and we can have a conversation about that. And I'd be happy to
Love
do
that.
it. Mhm.
Thank you. So we'll put your website in our show notes. I think this is a really important conversation that definitely we want to have you do a part two on because it's so different, right, than what we currently present to people as
Mhm.
the medical system.
Yeah.
And so, for our listeners, if something in today's conversation resonated, it's because you're not alone and you're not imagining it. We'll put more information in the show notes if you want to get in touch with Dr. Campbell and talk to her about where you're at. Certainly, if this episode helped you feel seen, please share it with another woman who needs to hear it. And next time, we'll be back with another wonderful guest on The Authentic Physician. Thanks for coming, everyone. Bye.